My name is Catalina Munoz Newton, and this is my final story project for New Student Experience. This is the agenda for the presentation. Here's the setting for my presentation, which will take place at a pre-medicine college lecture hall at the University of Central Florida. My intended purpose is to share my personal experiences in the medical field as an OBGYN residency student with the future generation of healthcare professionals. An introduction about me. Good afternoon. I'd like to thank everyone for attending this pre-med meeting today in this lecture hall at the University of Central Florida. My name is Catalina Munoz Newton, and I am currently in my second year of OBGYN residency at Winnie Palmer Hospital for Women and Babies. I am here to talk about my educational journey, such as the requirements needed to become a maternal fetal medicine doctor, as well as my work experience in women's healthcare. I will also be willing to answer some questions or concerns you guys may have. So let's get started, shall we? I'm a graduate from the University of Central Florida and Florida State University College of Medicine, and my current status is in my second year of OBGYN residency at Winnie Palmer. My personal purpose statement. My purpose as a maternal fetal medicine doctor is to help expectant mothers through my talents of command and focus by providing quality healthcare such as performing surgeries and prescribed medications to prevent illnesses as their bodies change and develop throughout the pregnancy. From a young age, I've always been interested in majoring in the science and working in a field related to women's healthcare, but it wasn't until freshman year of high school that when I learned about, in my biomedicine class about gene expression and how deformities occur in the womb. After that school day, I went on to research careers that were related to that and specializing in that area. Then it hit me. I finally narrowed down what exactly it was that I wanted to do, which was enhancing my knowledge in obstetrics and gynecology and continuing down the maternal fetal medicine pathway of gynecology. My personal purpose statement helped me by allowing me to explore my strengths and how they can be applied to my career, as well as motivating me to further my education knowing that I will potentially make a change in a woman's life. Day in the life as an OBGYN residency student. At Winnie Palmer is like I spend lots of time shadowing physicians and learning through observations. This area of medicine can be very stressful at times since I see multiple patients per day, each with their own unique reason for coming in. Whether it is good or bad, I also see patients that come in with various conditions that in some cases can be detrimental to both the mother and the baby. There are numerous complications that can occur in pregnancy, such as gestational diabetes, eclampsia, and ectopic pregnancies, just to name a few. In terms of my career pathway, there are multiple exams and licenses that you must obtain before you even earn the title and can practice medicine, including the SAT, ACT, MCAT, USLME, and ABOG certification, and more. Starting off with your last 2 years in high school, which is around the time where you start preparing for the SAT and ACT, you'll need to receive a minimum of 1100 on the SAT or 22 on the ACT to be accepted into UCF. However, these scores can vary depending on multiple factors such as location, cost of attendance, and population. Now we fast forward to your third and fourth year of college. If you want to get into medical school, you must take the MCAT, which is the medical college admission test, which demonstrates your knowledge of social science concept and skills necessary to the study of medicine. And this test is a very lengthy exam and can take months to prepare. It is not something you want to wait until last minute for studying. Once you're accepted and complete medical school, you will want to start looking into residency programs and aim to start studying for the USLME, which you must pass to obtain a medical license. Following completion of your residency program, you must obtain an ABOG board certified certification. Once finished, you are now eligible to become a licensed OBGYN. There's also the CME, which is the continuing medical education requirement that you must complete in order to maintain both your medical license and employment in some states. I had to complete all of these, and it was a very long journey, let me tell you. What does a maternal fetal medicine doctor do? Maternal fetal medicine doctors are highly trained professionals that are responsible for providing high quality health care to take care of women who are experiencing complicated, high-risk pregnancies. In addition, maternal fetal medicine doctors are also responsible for providing expert advice for when inducing labor is necessary, typically after 42 weeks gestation, monitoring the fetal rate, which is typically faster than the mother's and can be anywhere from 110 to 160 beats per minute. Career pathway and workforce skills. I'm going to talk about some of the skills in the workforce that I use daily as an OBGYN residency student. Required skills that you must have in order to be affiliated with any area of medicine, not just obstetrics and gynecology, include having a strong interpersonal and communicative skills, ability to work independently and in teams for things such as surgeries, as well as having significant knowledge of preventative care services. Some skills specific to OBGYN and maternal fetal medicine doctors include the knowledge of varied treatment options for the female reproductive system. You must be able to work quickly and efficiently since this job does have a strong tie to stress due to the long working hours. The last section that I'd like to cover with you guys is my personal academic pathway, which includes the specifics on where I attended school, the breakdown of my cost of education, and what resources I used to be successful and get through school that I believe would benefit you all. Starting off, I was a dual enrollment student at my high school and took every opportunity to minimize my costs for college. Some of the grants and scholarships that I used included the FAFSA and Florida Medallion Scholarship. I graduated in 2025 from Timber Creek High School with both my Associates of Arts from Valencia College and my high school diploma. As a result of being a dual enrollment student, I did not have to pay for tuition for Valencia. Following graduations, I transferred to the University of Central Florida to finish my bachelor's in biomedical sciences in 2027. I then decided to continue my education by attending Florida State University College of Medicine for my MD degree from 2027 to 2023. This brings us to present time in 2023, where I am in my second year of OBGYN residency at Wendy Palmer Hospital for Women and Babies. I still have a few more years left of residency and then fellowship, which I have lined up to complete at the University of South Florida. Below is listed is a breakdown of the in-state tuition for University of Central Florida. I paid roughly $14,921.48 for my overall tuition. For the Florida State University College of Medicine, it was 7 semesters, and I used both 2 scholarships, including the Dr. William Merrill Scholarship, which grants at least $7,500, as well as the NMF Scholarship Fund, which grants at least $10,000. This is the Florida State University College of Medicine breakdown continued. I paid roughly $152,378 for my tuition. This is not including the scholarship funds. Academic pathway, Valencia resources. While enrolled at Valencia, some of the resources that I used consistently included Valencia's Advising Center, which provided me with assistance on transferring credits, direct connect to UCF, and helpful links, etc. Valencia's dual enrollment advisor helped me make decisions on the order of classes that I should take and when. And that's it for my presentation. Thank you for watching.